Make no mistake, we are leaning heavily into this as leaders to see us move towards a mandatory vaccination for aged care workers.
After the events of the last week, it seems like a no-brainer. Ensure that people who work with our most vulnerable are vaccinated.
As it is done for flu vaccinations in many states and territories.
But it may not be that straightforward.
We also need to balance that unintended consequence potentially of affecting the workforce in our aged care facilities.
The risk? Leaving an already overwhelmed aged care system short-staffed.
What we do know from overseas experience is that when you mandate the vaccine, you do tend to discourage people and you do tend to turn them away.
Aussie authorities initially rejected the idea of mandatory vaccinations back in January. They're now reconsidering at the request of the PM.
We have not gone against the advice. We have referred back to the AHPPC this question about how this can be safely done.
The World Health Organization says mandatory vaccination policies should only be considered as a last resort. The first resort? Persuasion and communication, which hasn't exactly been exhaustive.
The messaging has just been too confusing. The information has not been clear.
And it could be fixing a problem that doesn't exist.
Well, our members haven't expressed any concern to us about getting the vaccine, and certainly they're much less hesitant than the average person in the community.
The timing of the announcement is convenient for the federal government, which has been copping heat all week over its aged care failures.
Are you seriously comfortable with the pace of this rollout?
Are you responsible, yes or no?
How can it not be your job to ensure that the workers get the vaccine?
What they're trying to do is deflect their responsibility, because you can't make something mandatory when you don't have reasonable access to it.
So, is this a clever deflection that goes against the advice of the experts, or a common sense move to protect vulnerable Australians? Well, Chief Advocate for National Seniors Australia, Ian Henschke, is all for mandatory vaccinations, and he joins us now. Ian, is this something that our aged care residents want?
Well, look, when we talk to National Seniors members, they say that what they want is some action on this, because we're obviously being confused by all the different messages going out there at the moment. I mean, you've got mandatory vaccination for the flu, but we haven't got mandatory vaccination for COVID. So this is why people can't understand why it isn't happening.
Ian, what about staffing levels? By already insisting that staff not work across multiple aged care centres, I would have thought that would create some problems with staffing, and now mandating. Won't that potentially make the situation even harder?
I go back to that point that all staff have to have the flu vaccine. So what is the difference between having the flu vaccine or having this vaccine? Now, if there is some hesitancy over the AstraZeneca in South Australia, where I'm talking to you from tonight, they have made the Pfizer vaccine available. So, look, if there's some hesitancy there, just get on with it. I mean, this is what we are looking at. I mean, it's rather strange that we're living in a bit of a fool's paradise here in Ireland where we can have these discussions. If you look at Italy, for example, they've just mandated that all health workers and aged care workers have to have the vaccine. And that's because they've had an outbreak and it was traced back to workers, unvaccinated workers causing the problem. So do we have to wait for a dreadful accident? It's like you have to put up a stop sign after the accident happens. I mean, we know that if you're a courier driver, you have to have a driver's licence. You know, why don't you have to have a vaccination licence to go and work in these jobs? We're doing it with flu, do it with the COVID.
The federal government doesn't even know how many aged care workers have been vaccinated, let alone how many are hesitant about it. And a lot of workers have struggled to even get the jab. Isn't this all therefore just a bit premature?
If you talk to a doctor, if you talk to a nurse, as I did the other day, I said to them, what's your thoughts? And they said, it's a no-brainer. So I don't understand what is going on here. And have a look what happened in Italy. Italy's only got twice the population of Australia, roughly. They had 3 million cases of COVID. They had more than 100,000 people die. And for them, they've made it mandatory. Now, why are they doing it? We're not doing it because in Italy, everyone would know someone who's got the disease or has died of the disease.
There's sobering statistics. Ian Henschke, always great to have you on the program. Thanks a lot.
Thank you very much indeed.
I agree with the nurse who spoke to Ian Henschke, right? It's a no-brainer. Surely, if an An employer has the right to say to an employee, if you do something, or in this case, don't do something that puts my clients or my patients at risk, then sure, I reserve the right not to employ you. It should be that simple.
I mean, I think it's important enough that it needs to happen. So even if you're an existing employee who doesn't like it, as long as they redeploy you and there's some way of making sure that that can happen, and then obviously look at the issue of whether or not there are people that aren't going to keep working in this sector, we need to keep on top of that. But the health need of it seems pretty obvious.
But it sounds like most of the healthcare workers don't have a problem with it.
Yeah.
This is deflection by the sounds of things.
And there's a lot of cynicism about that, and understandably so, because there are bigger issues in this space.
With so much content online, it's sometimes hard to keep up with it all. And let's face it, who has the time? The Project YouTube has you covered with the stories that matter. Hit subscribe for a daily list of the news that you need to know.